Joining us
Especially
now,
there.
NBC News medical contributor Dr. Vin Gupta. Get your advice from a doctor like the great Dr. Vin Gupta.
Brought him here to you.
Let's talk about raw milk, shall we?
Yep.
In the same way that we talked about the great achievements of vaccines being called into question and other things that were fluoride in the water that have been settled for generations now, there's this conversation about raw milk. Can you explain the idea behind consuming raw milk and why there's some danger to that?
Yeah, of course, Willie. So, actually, this is not something we used to talk about. The last 5 years, we haven't been talking about raw milk. There's a reason we're talking about it. It's becoming mainstream. But a recent survey by the Annenberg Institute found that 53% of Americans actually do not realize that raw milk is unsafe. And so this is a concept that, again, needs to be normed. Raw milk is not safe. And here's why. There's a lot of bacteria in raw milk that pasteurization, just the heating of raw milk, kills. But the concept here is that amongst especially holistic, proponents of holistic medicine is that pasteurization or heating is going to kill the nutrients, or somehow raw milk will bolster your immune system. Any number of things. And so there's a lot of myths out there about raw milk's health benefits that, frankly, a majority of the Americans either believe in or don't think raw milk is unsafe. Campylobacter causes big GI issues. Salmonella, listeria, much less bird flu. The fact that the USDA is testing now for bird flu, just to make sure we understand what's happening with spread, there's a lot of reasons not to ingest it. We just need to start to educate the public a little bit more because there's a lot of misconceptions.
I mean, I guess some people think if they boil it, if they boil it, they'll solve all those problems, right?
Exactly, and so that's where pasteurization is a more refined process, but it's really critical, and we have to break down this notion that somehow it's better for you if you've had a workout to have raw milk versus a commercial supply.
So what is the argument? Because we should debunk it if you want to, or just put it out there. What is the argument for raw milk?
There isn't any, and
there we go. There you go.
There isn't an argument for it. The myth is that somehow pasteurization removes, just like you would say, if you have actual whole vegetables versus break it down and have a smoothie, you're going to lose the nutritional value. There is this notion of something similar, that somehow pasteurization removes all the goodness of calcium and the proteins, and then you basically get nothing. That's what people think, and it's wrong.
Okay, let's go to the next story we're looking at here. Zepbound is emerging.
Yep.
There are all these weight loss drugs. I guess it started with Ozempic and other Wegovy.
That's right.
Wegovy, yeah. What are we hearing about Zepbound?
It looks like, Mika, this is another in a series. Last week, towards the end of last week, a trial showed that Zepbound does look to be more effective than Wegovy, the other weight loss drug on the market, in promoting weight loss. And
is it safe?
So GI intolerance is the big issue. Going from dose 1 to dose 2, getting people to actually make sure that they continue on their medications, that's tough because there's GI upset, whole host of other issues, but it does appear to be largely safe. What is extraordinary here is that cost issues aside and access issues, those are big deals. Both these drugs are incredibly effective, but now there is a world here that if you're not responding to Wegovy for whatever instance, maybe you can switch to something like Zepbound.
Okay.
And luckily, there's going to be oral versions of these medications, hopefully in the next few years, bringing down that cost pressure.
So, Dr. Gupta, on another matter, here's something that doesn't make anybody nervous. There's a mysterious disease, a flu-like illness that's been spotted as an outbreak in the Congo.
That's right.
Now, we don't know, the health infrastructure there obviously is lacking. We don't know a lot about this just yet. So, setting aside perhaps what this particular virus is, what are your concerns, though, about the Trump administration coming in? Considering all the anti-science rhetoric we've heard from so many of these people, the readiness level of this country for the next pandemic, whenever it might be?
Well, I think this is going to be something where we hopefully will see, if there is a pandemic or a pathogen of pandemic potential, something like Operation Warp Speed, which I think we can credit them in his first administration for really setting the stage for ultimately a pretty robust response. But that is going to be the big issue here, is pandemic readiness and making sure that transition really focuses on it, because what's happening in the Congo is worrisome. 460 cases of a respiratory illness, we think, over potentially 135 deaths. We don't know what's causing it. Whether it's this, whether it's potentially bird flu. By the way, bird flu is changing. We saw this in the case of a teenager in Vancouver, BC. They actually had a microscopic level, Jonathan. It looks like bird flu is actually changing, becoming more capable of infecting human tissue, human lungs. So things are changing, whether it's this condition, this disease in the Congo, whether it's bird flu, whether it's the common ailments. We have to make sure that the transition is really focused on this.
Keeping a close eye on that, of course, given our experience over the last 5 years. Finally, just a broader question about the incoming administration and vaccines. Obviously, if Robert F. Kennedy Jr. is made the head of the NIH, it will mean something for vaccines, given his years of skepticism, to put it mildly, about vaccines and his putting out there false connections between vaccines and autism and the like. But there are people who say, get your kids vaccinated now because they're going away. What is your expectation about what will happen with vaccines under a new administration?
You know, I do not think vaccines are going to go away. I think we have to reassure the public that they will not. There's a lot of guardrails in place. And you have to take the nominee at his word. RFK Jr. has said that he's not going to take away the vaccines, that he wants to promote more information on safety and to make sure that's readily accessible. So we in white coats welcome a transparent, honest discussion on safety and effectiveness. And if that's going to be the focus, we welcome that.
NBC News medical contributor, Dr. Vin Gupta, thank you so much for coming on. It's always good to see you.